Hi Todd, how are you?
Great to be here.
You're an FDM therapist, you're an FDM instructor, and you also wrote a book about FDM. You're one of our FDM family members from America. Where do you live exactly?
Fairbanks, Alaska, which is the northernmost part of Alaska above the Arctic Circle.
I just finished reading your book. It was an awesome read. It motivated the crap out of me. It just gave me this kind of feeling like, yay, go! Please tell me, what motivated you to write a book?
The book was originally designed to be given to patients and other practitioners who were curious as to what either they just had treated on themselves or they had heard what we were treating. Originally, it was basically to try and short circuit having to explain the model to patients. In our clinic, we move fairly quickly, and 5 minutes, 10-minute treatment isn't unusual. So to spend 20 minutes explaining the theory behind the model got to be just too much. Being able to hand the patient a book and encourage them to read it and then share it was really a kind of a powerful way of spreading the model in Fairbanks. Used it a lot to introduce other physical therapists and massage therapists and practitioners in Fairbanks just to what this new and different idea was. It was never really intended to teach anybody how to do FDM, but just more as an introduction into what people would be experiencing when they were treated with this model. Specifically, since it's much more heavy-handed than some of the manual therapies that are out there, wanted them aware of the bruising and tenderness, but also of the possibilities for success.
That's so clever. What kind of response did you get?
It's been well received. We give it away to course participants in the U.S. And I think it's a great way to introduce participants at the courses. Its format is basically our 4-hour introduction that usually occurs on the Friday night before our weekend courses. Patients love it. They really enjoy hearing the theories because we use these words in our clinical situation all the time. The continuum distortion or HTP. I had a patient just the other day say, I got your book, and I reference it after our visits so that I clearly understand what you were talking about. So yeah, it's been well received. Patients really like the other patient stories. Some practitioners don't find the patient stories that powerful or helpful, but since this was written in part for patients, other patients like to hear the success that people have had.
I really loved it that it didn't only showed us the miracle stories, but it also showed that there are some situations when it's not 100%.
Right. I think, the model is such a powerful tool. It's able to get you improvement even in conditions when you can't 100% fix something. And I think, again, not setting patients' expectations up so that they're going to, if they don't get 100%, they're unhappy. I got an email from a person yesterday that said 90% better, so grateful. 90% is pretty good when they could hardly walk when they came in.
Yes, and it also shows people that FDM is honest, right? I think this is one of the most powerful parts of FDM, that it's honest.
Yeah, we use that theory, that phrase a lot in our descriptions when people ask, well, what is going on or what is that? We basically say, I don't know, but the theory is, the model says, and so we're working in a model which is theoretical. It's not been proven. So we explain to the patients best we can, understanding that some of this might not be reality.
And I also heard that this book is now translated to Greek.
Right. Yeah, we have German and Greek editions. The German edition we did a few years back. Haven't found a distributor in Germany at this point. But yeah, the Greek edition is due or just came out, so that's pretty exciting.
That's so cool. You write in your book about your beginnings with FDM, how you got to know it, and that you actually got an FDM treatment before even knowing what FDM is. Can you tell me a little bit about what happened after that?
Yeah, so the treatment of my elbows was an incredibly life-changing event. I had elbow pain for 2 years and it vanished in one treatment. We were at a conference south of Anchorage in Alaska, and when I came down from my hotel room back to that conference without elbow pain for the first time in 2 years, I said, okay, now that I can think, because they had originally treated me so aggressively, 4 people, 2 people on each arm at the same time, I wasn't able to form a conscious thought. And so I said, okay, now that you guys are done with that, talk to me about what you did and explain it again. And that's when I took what they said. I went back to Fairbanks and I said, well, okay, I think I understand this. And the first few days back in the clinic, a few patients walked in with what I felt at the time clearly fit into the patterns that they had described. And I asked the patient, I said, you know, I think this is what's going on. I just learned something. Would you be interested in letting me try? I said, it can be uncomfortable and make bruise. And they're like, yeah, go ahead. And the first lady I remember really clearly, we were in a procedure room in our urgent care, and she had injured her shin, and she had cut her skin and had tissue pushing out, and that she never went in to have it sewn shut. It just healed on its own. But for the last 3 years, she had had pain in her leg. And I said, well, that sounds like a trigger band. And because she described a burning line, and then she had tissue pushing out, which is a herniated trigger point. I said, I don't even need to really believe anything, because the lady told me exactly what had happened. So when I treated her, I said, you know, can I treat you? She said, yeah. She jumped up, walked around the exam table 3 times, gave me a great big hug, and left the room. And I was just standing there kind of in shock. I was like, okay, what was that? A couple other easy treatments that I did in the clinic, mostly trigger bands and continuum distortions, you know, over the next few weeks. And that's when I said, I need to learn this. And I found the next available course, which was actually the international event in Hawaii just after Dr. Tapaldis died. And so I arrived in Hawaii not knowing the FDM family to basically find the eulogy and the funeral of Dr. Tapaldis for his friends in the community. So that was my introduction to the FDM family and how tight-knit it really is.
And then as we see, it's kicked off very well because you kept doing it till today, and you went deeper and deeper into it, into instructing and writing books. What was it like? Yeah, this process.
Yeah, so for me as a family physician in the United States, you know, we're skeptical about a lot of new things, and we want a lot of evidence. But having been in practice for about 10 years at the time, there's a lot of things you just can't help patients with. And so to get something so powerful, so changing to your practice, what I really appreciated about the model was the more I trusted what Dr. Tapaldis had said, the more I believed that the model had foundations, the better the results were. And so as I went back through all my osteopathic training, the manipulative parts, and reread and restudied that literature based on Dr. Tapaldis's model, it made so much more sense. And then as every success built more confidence. So as I was going through treating patients, I'd get success because, you know, I think it's really important people don't treat the hardest patients first. You know, they treat some of the easier patients, gain confidence, and as your confidence grows, you get more confident to try the really challenging patients. From there, we had Dr. Harar come over and teach several courses, and it was during the course in San Diego when I realized we have to do something in the United States. We can't afford to have Dr. Harar come over and teach every time we all want to get together and learn about FDM. So it was at that point that I committed myself, based on tremendous success in the clinic and then the practical nature of needing to have instructors in the US. At that time we had none, and so I started studying and took the exam and became an instructor. The last 10 years I've committed to teaching the FDM a lot because of the feedback from other practitioners who have the similar success. that's kind of what feeds me and motivates me, knowing that while I'm remote in Alaska, I can go to a course, teach a person, and they can have such an impact on their population, you know, hundreds and thousands of miles away, just because we were able to share that model and get it into their hands.
That's so cool. That leads me to a next question. Like, how do you guys connect with each other in the US within the FDM family?
Yeah, it's more of a challenge, I think, in the US. We have a lot of differences in our degrees as well. So there's physicians, both MD and DO, which are full licensed physicians. We try to go to different meetings, but then we also have a great group of physical therapists. We've even started training our chiropractors, athletic trainers. In this country, a lot of the athletic trainers are manually trained and work with a lot of the pro sports teams. So it's a lot of internet, you know, advertising, trying to get the word out there. And frankly, we can do better with that. We have, I'm hoping that now with this time of isolation that we're actually going to expand our options and try to contact even better. But we've gained some footing in the osteopathic medical school realm. We're trying to get it added to the curriculum of all the osteopathic schools so that Dr. Topaldis's information will be part of the second-year medical school curriculum for these students. That's the hope for the upcoming textbook as well, that will be part of, you know, the curriculum or available to the students, and it'll, again, aim for some easy treatments. They'll get more and more vested. But yeah, being connected is hard. We usually try to basically volunteer our time at the big meetings, and then we meet every year at the American Academy of Osteopathy's meeting, which has a rotating location, and we really try to connect as a family at those events.
Wow, that's huge that you guys got to the point where FDM can be a part of the official training.
Yeah, it's been my goal. I know there's a lot of FDM people out there who FDM is it, and that's all they use, and that's all they're gonna embrace. But in my experience as an osteopath, pretty much everything I can do as an osteopath is better explained if I have the model to hang that knowledge on. And I would say, I mean, that goes for athletic trainers and all sports people. I mean, the way we teach it here in the U.S. is you don't have to abandon your previous knowledge and just accept blindly that FDM is the solution. I really feel that if you can do that during your opportunity to learn the model, it's much easier to learn the model because you're a blank slate. But then I think intellectual people, smart people who are trying to help their patients will then go back and apply what they already knew and put it into the model and then come out going, geez, yeah, I know that makes sense. And that's the powerful thing to me. I really see it helping our students in the early parts of their career understand why we're asking them to do what we're doing in osteopathy, but through the model.
Do I understand it right that now not only physicians are allowed to do FDM in the US, but also other health professionals?
Yeah, so originally Dr. Topaldis was pretty established that he just wanted physicians to learn FDM, both MD and DO. And the reasoning for that is physicians are an arrogant group of people, and they won't listen if you try to push it upstream, so to speak. And so he wanted to change medicine, and he wanted it from the top down. And he struggled with that in the US, and he didn't get a lot of reception from those groups because they're very evidence-based. When he passed away, we stayed true to that, probably longer than we should, and we alienated a lot of our physiotherapists that were frustrated that they weren't getting this knowledge. That changed many years ago. And then since that time, we've run into situations where key specialties are needing the same knowledge. And so the chiropractic, the athletic trainers, all of the professional sports teams in our country have athletic trainers that do the vast majority of the work. One of Dr. Topaldis's dreams was that, you know, every baseball team in the United States would have a FDM practitioner. Well, if I'm only training the orthopedic surgeons, FDM, they're never going to do it on their patients. They make a living in the operating room. So for us, it became, we need to train the people who will use the model. And that's, you know, family practitioners, physical therapists, chiropractors. We don't train a lot of chiropractors, but the ones who show up are usually broad-minded and have a good background, that they're ready to go beyond the narrow training of the chiropractic field. Yeah, but the athletic trainers and the physical therapists have been a huge success for the AFDMA and getting the model to spread. Most physicians in the U.S. don't use manual therapy. Even the osteopathic physicians, it's a low percentage of providers who use it on a daily basis. I'm proud to say that that's different in Fairbanks, because most of the people here have learned FDM. Even the MDs use it here. You can go to your family practitioner and you may get FDM for your headache because that's what they learned in residency. So I would agree with that. In the United States, most manual therapy is probably done by physical therapists. But my hope by teaching it to the osteopathic students is that it makes it a much faster and better grounded tool that they can apply rapidly. One of the issues that the students see is many of the specialists who teach it at the osteopathic school level talk about hour-long appointments and kind of esoteric concepts that are really hard to grasp until you have good experience. And frankly, in our medical system, it's a volume-driven business. It's turnover. It's almost like waiting tables. The more tables you can serve dinner to, the better your income is, the better the system does. So to have hour-long appointments, you really struggle to survive. With the FDM, when we teach it at the Mayo Clinic residency program, one of the things they love is they can incorporate a manual treatment into a treatment of hypertension and diabetes. So a doctor can treat your diabetes, your hypertension, and your low back all in a 30-minute appointment because they have the tool of FDM. You can't do that if you are only traditionally trained in some of the manual therapies. You have to have special long appointments.
You also write about the financial aspects of FDM according to the government and the health systems. Can you tell me a little bit about that?
Yeah, to me, you know, having the FDM is such a powerful diagnostic tool. We talk about it in our courses that if FDM doesn't work, then you need to look for other reasons. But when FDM works, you don't need to look for those reasons. So why would you order x-rays and MRIs and imaging if the patient's better? And so from a healthcare system perspective, having that powerful tool where you can treat somebody and their shoulder pain goes away, they don't need an MRI. Our system is very heavy on diagnostic imaging and procedures and injections, and that's what drives basically the healthcare economy, but it's also what drives cost. And as we look at trying to maintain or reduce costs, I see patients all the time where they've been through 4 or 5 doctors, they've had imaging done, sometimes more than once, and they walk in and 5 minutes later their shoulder pain is better, maybe not gone, but way better. And they didn't need any of that imaging done because they're at a place where they're content and happy. So I think if we look at applying the FDM universally in healthcare in our country and in any country, you're just going to reduce the number of unnecessary tests and imaging that are done on a daily basis. We actually started a project with older Americans on the Medicare system, which is our social healthcare system, that we want to look and see how much it costs to treat that person with, say, knee pain with and without OMM FDM. And can we show that we are cost effective in even more so than if they go the traditional route? Because for us, I think if we can show payers, government payers or private payers, the insurance companies, that, look, if we treat them with FDM, they don't do these 5 things and it saves you money in the long run, then FDM could actually be the preferred, treatment. I usually say that if I owned an insurance company, pretty much everybody would need FDM before they went on to their surgery for musculoskeletal issues.
Wow, that's awesome. I feel like EFDMA and AFDMA are doing quite a lot to spread FDM. Still, I feel like we don't know each other enough. Yeah, there are some people who know everyone, the FDM enthusiasts, the FDM freaks, they know everyone, they're there all the time. But I'm talking about everyday FDM therapists. I had the pleasure to meet you because you seem to be one of them who are there all the time, because you were here at the last symposium in Vienna. And you're just such a lovely guy. It's a delight talking with you. And I feel like we want more of you, right? So would you be open for short interviews where European FDM therapists could ask something from you and you would just give an answer?
Absolutely. I think it would be a great opportunity to exchange information. There's nothing magical about the people who've been in the FDM a long time. It's just the more confidence you get with the model, the more you understand it, the little nuances, and it's great to be able to share that with new practitioners and even established practitioners.
Thank you in advance. And you who are listening to this interview, now here is the opportunity. You just post your questions to the video, or you send an email to me. I'll just put the email address there, and then you can just send your questions and Todd will answer. He's a very lovely guy. He won't bite, right?
Right.
The last question is, do you have a message to European FDM therapists?
I think the message is always to just hear the model as it's presented. And then once you've got a good solid framework, put it into your daily practice, use it, get comfortable with it, challenge some of the thoughts and understandings. Some of the things that we've run into between the US and Europe are the dogma or the exact details sometimes can be nitpicked and argued. But I think overall the model is such a solid framework that Dr. Tapaldis left us, that just learn the framework and then hang other things and other knowledge onto that model will make you a better practitioner and help your patients in the fullest way possible.
Thank you so much for coming and answering my questions. And then I'm looking forward for the questions from you guys. And then we will do some short interviews with you. Thank you again for this opportunity.
Thank you very much for the opportunity. It's a shame I can't get over to Europe anytime soon because of all that's going on. And I was looking forward to seeing everybody again in Japan. So with that being postponed, we got to do what we need to stay connected.
Yeah, once it will be over, and till that we do what we can.
Exactly. We'll have a big party somewhere.
For sure. Yeah, so thank you again. Bye-bye.
Bye.